Hi, hello friends, welcome to World Explorer India. Today let us discuss about schizophrenia. Schizophrenia is the term coined by the Eugen Bleuler in 1908. The word schizophrenia, if we divide it is schizos means split and phrenia means brain or mind. So schizophrenia is a disorder of psychiatry where the major symptoms of psychotic disorders are being exhibited in the disease. The word schizophrenia is a misnomer and it is a functional psychotic disorder. Schizophrenia is characterized by the symptoms of psychosis and also leading the disability affecting personal, family, social, educational, and occupational functioning. According to World Health Organization, 1 out of 3 patients with schizophrenia can fully recover with the proper care. The risk factors for schizophrenia include the birth complications, severe maternal malnutrition, maternal influenza during pregnancy, family history, childhood trauma, social isolation, and use of the recreational drugs such as cannabis. Men are more impacted as compared to the women. Even men are going to get schizophrenia in earlier age as compared to the women. Usually, schizophrenia is seen in the adults and early onset adults from the age of around 20 years. 1 in 222 adult population, that is approximately 0.45 percentage, is the incidence or magnitude of the schizophrenia, and in the worldwide it is approximately 1 in 300 people worldwide, that is approximately 0.32 percentage population are suffering from the schizophrenia. Schizophrenia, being the mental illness, has some stigma around the individual who is experiencing the symptoms of schizophrenia. The fear of mental illness and also getting the treatment and lack of societal support is again causing a lot of burden to the patients. Even during emergencies, there has been seen that neglect, homelessness, abandonment, abuse, and exclusion from the society. These are all the human right violations which are being occurred on the patients with schizophrenia, not only in the society and also in the mental health care institutions. These persons are getting abused or getting violated from their human rights. Schizophrenia is a disorder which is approximately more than 50% of hospital admissions are accounting for the schizophrenia. Schizophrenia is characterized by the symptoms of hallucinations, delusions, thought disturbances, disordered thinking, perception disorders, behavioral issues, cognition, memory, attention, problem solving difficulties, negative symptoms, etc. Here, the symptoms which we are seeing on the screen are being divided into two types of the symptoms, that are positive symptoms and another is a negative symptoms. As you see in the last point, that is negative symptoms, that is apathy. Apathy is lack of interest to the surroundings. They are not at all interested, or they are not able to enjoy what all others are enjoying, and they are keeping themselves isolated. They are not speaking to anyone, they are not even telling their problems to anyone. So these are all called as negative symptoms. When there is a negative symptoms, it is very difficult to treat because we are unable to identify the exact problems. But if it is a positive symptoms like hallucination is they may be feeling some of the sensory stimulus even in the absence of a stimulus. That means if a person is hearing some voice, even though there is no one around him who is speaking, but they are listening a running commentary that people are talking about him or her, or sometimes these hallucinatory voices are giving them commands to go for the self harm or to harm someone else, etc. So these are very dangerous symptoms which we see in a patient with a schizophrenia. Next thing is delusions. Delusions are the false fixed beliefs irrespective of the socio-cultural and educational background. So delusions means, for example, let us say 2 plus 2 is equal to 6. If it has been taught to them by a teacher, they believe always it is 2 plus 2 is equal to 6, irrespective of how much you convince them that 2 plus 2 is 4. They are not able to get convinced because they are having such false fixed beliefs in their mind and they are unable to erase them in easy manner. So again, delusions are a lot of types of delusions and even hallucinations are there. All these things I have already covered in the previous presentations in my YouTube channel. You can go through the psychiatric revision presentations. And next thing is the thought disturbances. Thought disturbances means they are unable to think properly. That means they may be feeling that their mind is getting inserted with some of the thoughts by someone else, or they may be thinking something and they are feeling that their thinking process has been exhibited on the television or a movie screen, and etc. Means they are thinking that their thoughts are being stolen and being broadcasted in a television. And next thing is disordered thinking and perception disorders. Perception disorders means they are unable to identify what is exactly in front of them, and they may misperceive it. For example, perception disorders such as illusion. For example, what we can see, if we are seeing a rope, they may misidentify it as a snake, even in the sunlight. It is very common for us that if it is a darkness and if there is a rope lying on the road, we may get confused it as a snake. It is because of the inadequacy of light or our previous thoughts, etc. But here in schizophrenia, they are having this type of illusions even in stimulus, that is even in the daylight, or they may be misperceiving the situations or misperceiving the objects, etc. Next is the behavioral issues, and the persons with schizophrenia is also having the issues with the cognition and memory, attention, problem solving, etc. So these are the main symptoms of the schizophrenia. If schizophrenia is to get diagnosed according to ICD-10, that is the International Classification of Disorders, and they should experience at least one of the symptoms for a period of 1 month. Symptoms such as thought insertion, echo, thought broadcast, thought withdrawal, or delusions of control, influence or passivity, hallucinatory voices, etc. Or at least two symptoms from like hallucinations, neologism. Neologism means they are coining some of the new terminology, and the terminology meaning is being known only for them, but other person who is speaking to them doesn't know what does it mean. And catatonia is again stiffness or some of the other catatonic features. And negative symptoms like as I have already discussed, it is social withdrawal, mutism, etc. So these are all the symptoms which will lead to the diagnosis of schizophrenia. And next type of classification is DSM, Diagnostic Statistical Manual, DSM-5. Here they are not dividing the schizophrenia according to the symptoms, but they are divided into subdivisions like paranoid schizophrenia, heavy phrenic schizophrenia, catatonic schizophrenia, undifferentiated schizophrenia, post-schizophrenic depression, residual schizophrenia, and simple schizophrenia. Here I am giving you a overview like paranoid means suspiciousness. If they are having always suspicious mind, that is called as a paranoid schizophrenia. Undifferentiated is if any of all other types which we have discussed is not being suitable for that patient, then that patient will be put in the category of undifferentiated. Next thing is after schizophrenia, if they are experiencing symptoms of depression such as hopelessness, helplessness, and worthlessness, then it is called as a post schizophrenic depression. Residual schizophrenia means after getting the treatment, they are still getting the symptoms of schizophrenia, then it is called as a residual schizophrenia. So, and there are some other types like catatonic and schizophrenia, simple schizophrenia. These types I will discuss more in detail in the next presentation. So, whenever a patient is coming to the psychiatric OPD or an inpatient in a mental hospital, what we have to do is we have to get the thorough medical history and drug history, family history, social history such as use of drugs, alcohol, neurological impairments, and Parkinson's disease, multiple sclerosis history, syphilis, AIDS, brain lesions, heavy metal toxicities, delirium, endocrine disorders, dementias like Alzheimer disease, frontotemporal dementia, Lewy body dementia. Why these are all needed is sometimes we may get confused with the symptoms of these disorders with the schizophrenia. That means these symptoms will mimic as a schizophrenia. So what will happen is sometimes the diagnosis is misdiagnosed. So what will happen if there is a misdiagnosis? We are giving unnecessary treatment, unnecessary side effect to the patient. If there is no proper thorough initial investigation being done on a patient. So it is very essential for us to identify are the symptoms is because of mental illness or because of any other organic diseases such as Parkinson's disease or it's related to syphilis, AIDS, etc. So these are all the things which we should identify in the earlier stages. Apart from this, a thorough lab investigations are needed like urea electrolytes, serum calcium, blood glucose. Sometimes like even on hypoglycemia, they may be experiencing confusion. Again, this confusion we may treat it as a mental illness. So that is very wrong practice which we do. So it is better to have initial investigations thoroughly like urea electrolytes, calcium, blood glucose, even thyroid function test because if you see in hyperthyroidism they may be very much active, we may again think that it is a mental illness, so it's not like that. So again, apart from this, some of the hormonal imbalances which we see in the endocrine disorders such as hypercortisolism in the Cushing syndrome and adrenocortical insufficiency in Addison's disease. Apart from this, we have to see the if there is any use of drugs like misuse of the drugs like cannabis. So this can be identified with the urine toxicology. And to identify the neurological diseases as we have discussed in the previous slide, it is better to undergo patient for a CT or MRI and also have a triple screen test like HIV, HBsAg and HCV, etc. The treatment modalities include the antipsychotics, olanzapine, quetiapine, etc. These are all the second generation antipsychotics. Now, why it is second generation? These are the drugs which are having less extrapyramidal symptoms. Again, I am going to make a new video on extrapyramidal symptoms. Next thing is benzodiazepines, diazepam and clonazepam, and these may be needed. And if the patient is having anxiety, they may need anxiolytics. And we have seen a diagnosis that is post schizophrenic depression, which is characterized by the symptoms of depression. Then they may need the antidepressants. And the most important therapy for schizophrenia is the cognitive behavioral therapy. Cognitive behavioral therapy means we are trying to change their cognition. Cognition is nothing but thinking pattern. So how this thinking pattern is being developed, we know what is the process of how the thinking is being developed in a patient. So we're trying to correct the thinking process so that their behavior can be altered. That is called as a cognitive behavioral therapy. So it is very essential to undergo the differential diagnosis from the substance induced psychotic disorders, sleep disorders or neurological disorders, delusion disorders, drug abuse and developmental disorders, personality disorders, or sometimes psychosis because of organic causes. Life expectancy is decreased in a patients with schizophrenia as at least 20% is reduction in the life expectancy and 40% is attributed to the suicide. Patient education is needed for the modification of risk factors and smoking cessation, and ask them to do exercise daily and also engage in healthy diet patterns. And most important is cognitive behavioral therapy. As we see, patients with schizophrenia are experiencing the stigma and discrimination, so there should be provision for community based care, like if possible home based care being given to the patients, and also the care being provided at the primary healthcare centers or sub centers, etc., and also supported housing outreach services for the home based supports, etc. And there is a need for the training on how to use the medications, what are the side effects of medications, and what are the lab investigation they should undergo, how frequently they should attend the OPD clinics, etc. And also what is the importance of family and society support in treating the patients. As WHO already said, 1 in 3 persons can be fully recovered, so it is essential to escalate the community based care for the patients with schizophrenia. This all information is gathered from World Health Organization website and also NCBI website. And do like this, subscribe, and comment your opinions or further recommendations. Thank you.